All right, I'm Josh and I'll be doing my straight cath validation today. Okay, so we'll go ahead and we'll start off by looking at our patient's chart. So we have Mary Sanford, date of birth 11/12/98. She has no known allergies. She is a full code and she is a low fall risk. So Mary is a 26-year-old female who had a vaginal delivery of her first child 6 hours ago. She has past medical history of an appendectomy in childhood, wisdom teeth were taken out as a teenager, and she currently has hypothyroidism. Her current medications are levothyroxine 100 micrograms by mouth daily, prenatal vitamin 1 tablet by mouth daily, and then her family history: she lives with her husband in an apartment. She recently quit her teaching job to become a stay-at-home mom. So the nurse prior to me, her report says that her vital signs are pretty much within normal limits except for her respirations, which are a little bit high. She is alert and oriented. She is grimacing with pain. She has sinus rhythm. Her breath sounds are clear. She has normal bowel sounds. And then for her GU, she had a Foley catheter put in during labor for her epidural. Her Foley was removed prior to pushing, and she had been unable to void since birth of her child 6 hours ago. She feels bladder pressure but is unable to void due to discomfort and swelling of the perineum. So we'll go ahead and check that. Her extremities are pink and warm, equal in all extremities. Skin pink, warm and dry. Neurological, alert and oriented to person, place and time. Her perla looks good as well, and she has no neurological defects. She has 1 IV in and 18 gauge in her left forearm. Her labs are within normal limits. She has a low risk for falls. Her pain is in the vaginal area and perineal area from her birth. She rates it a 4 out of 10. And then the physician says that they'll be going to do some assessments a little bit later. So looking at her orders here, she's to be admitted to OB, diagnosis of post-normal spontaneous vaginal delivery. She's a full code, general diet, vital signs every 4 hours, notify the healthcare provider if anything changes. And then what we're going to be doing today is we're going to be inserting a straight catheter, and then she has hemoglobin labs tomorrow at 6. Okay, so we'll go ahead and go into the supply closet and we'll get our straight catheter kit. We'll go ahead and check our straight catheter kit to make sure that everything looks fine. Packaging is not opened and it's sealed. And then we'll also go ahead and look at the expiration date and note that it is not expired and we can use this. And then we'll also note the size that we'll be using, which is a 14 French, which we know will work with her. Okay, so now we'll go ahead and we will go check in on my patient. Knock, knock, knock. I'll perform some hand hygiene. Hi, I'm your student nurse. Can I go ahead and get a name and date of birth from you?
Mary Johnson, 11/12/98.
All right, perfect. Okay, Mary, do you have any allergies?
No, I do not have any allergies.
Nope. Okay, perfect. And we know that from her chart that she has no allergies, and that's the birth. And then we can look at her code here, and that looks totally fine. All right, perfect. Okay, Mary, so I hear you're having a little bit of bladder pain, is that right?
Yeah, a little bit of distension and I can't pee.
Okay, all right. So today what we have ordered is a straight catheter. Do you know what that is?
Yeah, I think I had a Foley catheter while I was in labor.
Yep. So there's a little bit of a difference between a Foley and a straight catheter. A Foley basically stays in for a little while and then it just empties out that urine. And then a straight catheter is a little bit different in that we just put it in, we empty all the urine, and then we take it right back out. So it's a little bit, it doesn't stay in for a longer period of time. So we'll go ahead and do that today. Would you be interested in that?
Yeah, I would. That sounds great.
Perfect. And it should help with any discomfort that you're having with your bladder, okay? So what we're going to go ahead and we're going to do first is I'm going to go ahead and raise your bed, and we're just going to go ahead and assess your abdomen and your urethra real quick, okay?
Sounds good.
All right, so hand hygiene, and I'll grab some gloves.
Last time. Ready?
So Mary, you said you were having a little bit of pain. Can you go ahead and tell me what that would be on a scale of 0 to 10?
Yeah, I'm feeling a 4 out of 10 pain right now.
4 out of 10 pain. Okay, let me know if there's any pain while I'm palpating here.
Yeah, just a little bit.
Yeah, a little discomfort. Yep, I can feel that it's pretty full. So a straight catheter would be good here. And then I'll also check out your urethra here to make sure that it's okay to put in a straight catheter, and it looks like it is. Okay, so we'll go ahead and put everything back together for you here. Okay, so basically what's gonna happen with this procedure is we're gonna go ahead and we're gonna put your legs up, and then we're gonna have everything set down here, and there might be a little bit of pressure when we go ahead and insert that, okay?
Okay.
All right, now what I'm gonna go ahead and have is the CNA is gonna come in, and they're gonna go ahead and clean you up down there to make sure you're all ready for the procedure, all right?
Okay, sounds good.
All right, perfect. So now we have your bed locked and lowered. Call light is in reach. I'll perform some hand hygiene. Do you have any questions before I head out and grab my stuff?
No questions.
Okay, fantastic. All right, so we'll leave the room, provide privacy, and we'll come back out and we'll grab all of our stuff, make sure we have everything ready, and we know that we're giving this because she has abdominal distension and hasn't been able to void in the past 6 hours. And we know this is the right size. Okay, and now that the CNA has cleaned everything and we've inspected everything, we can go in and put in the straight catheter. Knock, knock, knock. Hi, can I go ahead and get your name and date of birth?
Mary Sanford, 11/12/98.
Perfect. We'll go ahead and provide some privacy, do some hand hygiene. We'll check her wristband. Fantastic. All right, Mary, can you go ahead and let me know if you have any allergies?
No, I do not have any allergies.
Fantastic. And we can see that on her chart that she has no allergies. Okay. So now that the CNA has cleaned everything up, we're gonna go ahead and we're gonna start this, okay?
Sounds good.
So we're gonna go ahead and raise the bed to working height, okay?
Mm-hmm.
All right. And then we'll go ahead and we'll just bring this down for you so it's out of our way. And then we'll just bring your gown up. All right, and then I'll assist your legs, and I would also have a CNA in here to help hold the light if need be. Okay, are you feeling comfortable?
Yeah, I feel comfortable right here.
All right, fantastic. We'll perform some hand hygiene, and we'll get our kit right here. All right, and we'll just do one last check, make sure everything's okay. It looks like everything's okay. So now we'll go ahead and we will start our procedure, okay?
Mm-hmm.
So we'll go ahead and we'll pull away from us here. And we will take our gloves first. Take that here. We'll open these up and we will use the little flaps here, only touching that 1-inch border. Okay, now we'll go ahead and we'll glove our dominant hand first. All right. And then we'll go ahead and glove our non-dominant hand, touching the sterile parts of the glove. All right, so now that we have our sterile gloves on, we'll go ahead and drop this into the trash. All right, and we'll move over to the bed. Okay, Mary, we're gonna go ahead and we're gonna take out a few things that we can go ahead and put over you just in case any bit of urine spills, all right?
Sounds good.
All right, and we'll put the shiny side down, ensuring that Got that all covered. Fantastic. All right. Now we'll go ahead and take another drape that we're just gonna drape over you, okay?
Sounds good.
So we'll go ahead and put this. Making sure that you're covered up a little bit. Okay, now we'll go ahead and we'll take our sterile cup. We won't be getting that today, so we can drop that right in the trash. Okay, now I'll go ahead and look at my catheter. My catheter seems fine. We'll take our lubricant and we'll go ahead and get everything ready with that. Make sure to lubricate the catheter. Go this way. All right, so our catheter is lubricating. So then we'll go ahead and we'll take our cleaning sticks and we'll set everything up here. All right. So now that we have our cleaning sticks, we'll go ahead and use our left hand to spread. And this hand is now contaminated, so we will not be using it for other purposes. And we'll go ahead and clean outer and drop. We'll take our next one and we'll go outer and drop, and we'll take our last one and we'll go right down the middle and drop, and then we'll go ahead and get rid of this as well. All right, now we'll go ahead and we will take our lubricant and we'll let that go, and we now know that this is lubricated. All right, so you might feel a little bit of pressure when we go in here to begin with, okay? So we'll go in about 2 to 3 inches for female and then 1 inch farther to make sure there's urine flow. And then for a male, we would go 7 to 9 inches, 1 inch farther to make sure that there's urine flow. All right, so you're gonna feel a little bit of pressure, okay?
Okay.
So 2 to 3 inches. All right, 2 to 3 inches, advance a little bit more. We can see that urine flow is coming out. We'll wait a while until the urine has all come out, and it looks like the urine is now good. So now we can go ahead and remove the catheter nice and slow. Throw away our catheter. So now we'll go ahead and check our urine output. All right, looks like 250 mils of urine. We'll go ahead and make note of that. We'll make note of the color. It's yellow and straw-like. The consistency is fine. There are no abnormalities or obstructions or anything like that inside the urine. So we'll go ahead and we will dump that out into the toilet and everything and make sure that's all prepared. And we'll document that later. And then we'll go ahead and we'll get rid of this stuff, making sure that she's all cleaned up. We can go ahead and get rid of our gloves. All right, and then we'll go ahead and put you back into a normal position for you, okay?
Okay.
All right, and how did that feel? Was that painful at all or anything like that?
No, it wasn't painful at all. And
No?
I feel a lot better now.
Okay, good. How would you rate your pain?
I'd say a 1 out of 10.
Okay, 1 out of 10, perfect. And I'll go ahead and we'll just feel around your abdomen to make sure that it's not distended anymore, and it doesn't seem to be. Is this painful at all?
Nope, not at all.
All right, perfect. Okay, so we'll go ahead and we'll lower your bed, and then we'll make sure you're all set. Do you have any questions for me?
No, I don't have any questions.
All right, fantastic. So now you have your call light in hand, bed is lowered and locked. I'll perform some hand hygiene, and all of our trash is cleaned up. We'll provide some privacy. We'll go ahead and document the amount of urine, the color of the urine, the consistency of the urine outflow, and then we'll update the provider with any changes that happened. And we'll go back in and we'll go ahead and we'll assess her, okay? So knock, knock, knock. Hi, I'm your nurse, Josh. I'm back for a little bit of an assessment. We'll provide some privacy. There's some hand hygiene. I'm gonna put on some gloves. All right. So we'll go ahead and we'll give a check to look at your abdomen again. This will be a nice little quick one. We'll go ahead and we'll check that abdomen. Any pain, any?
Nope, no pain.
Nope. Okay, perfect. And we'll just go ahead and check your urethra, and your urethra looks fine. So the patient tolerated the procedure just fine, and we'll document any changes that we found. Perform some hand hygiene. All right, Mary, we'll make sure you're all good. Bed locked and lowered, call light in place, and we'll provide privacy. I will document any changes that have happened.